founder of the Pi Oncology Cancer Care.
The vision behind pi is, अगर आप pi का वैल्यू देखो 3.148754 etc. First 12 digit, there is no replication. Same way, 2 cancer patients walking in my clinic are not same.
In oncology, there will be the 3 specializations.
Yes, stage 4 cancer, you should meet a medical oncologist. 3, 2, 1, combination of all 3 are required.
What is the most common cancer you see?
For males, oral cancer, simply because of tobacco chewing, lung cancer and colon cancer. For females, breast cancer tops the list, ovarian cancer, cervical cancer.
Vamshaparya, like familial, heredity, genetical, like so how that you will explain?
By default, all cancers are genetic. Not all cancers are familial.
What is this actual blood cancers?
Blood cancer is of different types.
There are some cancers of leukemias in the pediatric.
Correct.
Children may. How you are going to disclose it? Reveal this to their parents?
Very difficult. Very difficult to tell somebody has cancer.
So this blood cancers means we have to find out which type of blood cancer. Based on that, curable, non-curable.
Yes, correct.
Are there. So coming to the curable cancers, we can take some of the examples like celebrities.
Correct.
So one of the cricketer like Yuvraj Singh.
Correct.
So for the outside, for the world, he got some cancer. I think half of the people might have, because of this lack of knowledge, he got cancer, he will die.
Yes.
But he is
completely
cured. He played cricket also after this.
Yes.
Can you tell me that what this Yuvraj Singh, like or some other celebrity, what did he got exact cancer and how did he got complete cured?
So good that you have brought this. This will also clarify one misconception that cancer is death sentence. Each cancer has a different outcome.
Okay.
So there are some curable cancer, even in stage 4.
Stage 4.
Even in stage 4. For example, lymphomas. Advanced metastatic lymphoma also we can cure in majority of cases.
Okay.
And some cancers are very bad even in early stage. For example, gallbladder.
The gallbladder.
Gallbladder, urinary bladder. If just one spread from local area to one lymph node, it becomes non-curable.
Sure.
So anyway, what I am saying is all these celebrities, celebrities who get cured, there are celebrities who don't get cured also. So the celebrities which are lucky enough to get a cancer which is curable, like Yuvraj Singh had a germ cell tumor. It's a kind of I'll say lymphoma type thing.
Okay.
Blue cell tumor we call it.
Okay.
So germ cell tumors, lymphomas, myelomas, they are curable.
Okay.
Then there are celebrities who got cancer which is not curable. Steve Jobs, Apple, he got neuroendocrine tumor
of the pancreas.
Which he could not treat because of so many geopolitical reasons. If Steve would have been in Europe, there was a therapy at that time when he expired, dotatate therapy, which was approved in Europe but not approved in US.
Okay.
So since that therapy was not available in US at that time, he could not take it. I'm not saying it's curable, but we could have had more time with Steve Jobs in this world. So type of cancer and then therapy is available. So just like I said, stomach cancer, CAR T cell available in China. Even if celebrity chose that he will not go to China for a treatment, then the weapons against cancer reduces. So the type of cancer therapies available is constantly evolving.
Okay.
So that is what. And one last thing, most of the celebrities have access to the latest of latest.
Latest of
The
latest?
technology.
Yes, okay.
A therapy which is just approved, just came into the market, not available for everybody else in the country. But celebrities can get those medicines.
Means celebrities means here who have that spending capacity.
The financial resources.
Financial resources.
True.
Yes, sir. Sir, in this, like in the oncology part, treatment, so many people know that like chemotherapy, that a basic term.
Yes.
Apart from this chemotherapy, there are other treatment types also. We call it targeted therapy,
Correct.
immunotherapy,
Correct.
and some latest advances also it came.
Correct.
So first we'll talk about this chemotherapy. So many people will think that chemotherapy taking more than this, there are more than side effects.
Correct.
People will fear for that side effects and they stop taking it.
True.
And if they take also, they will discontinue it. Okay. So is this really that chemotherapy is that much of what you say dangerous to take, or is that much of side effects are there?
Yes.
Or it's not to bother about that.
Okay. So first, little history how chemotherapy came into the world. So chemotherapy is actually a poison. To be very frank, it is a poison.
Poison. Okay.
Yes. And the medicinal effect of this poison was found in World War II.
Okay.
World War I, World War II, when in concentration camp, German concentration camp, lot of Jews was gathered, the gas was released. After people have died, autopsy was done, and scientists found that there was a depletion in the bone marrow cells, the WBCs. And then the first concept came, okay, if WBC is high, that is in blood cancers, since this toxin, the gas, mustard gas, it was that time, giving this probably can bring the blood cancer cells down. So the concept of chemotherapy happened from World War II.
Accidental innovation.
Accidental innovation, unfortunate for a lot of people. We gave so many people died during that. But yes, the concept started from there.
So this chemotherapy is actually poison, but innovated during World War II.
Repurposed for treatment post World War II.
Okay.
And now with science, safer and safer and safer chemotherapy happens. But all chemotherapy by default is a toxin. It kills any cell which is fastly dividing.
Okay.
What are the fast dividing cell? Of course, the cancer is fastest dividing cell.
Okay.
Hair, fastly dividing. Every day hair is growing. Mouth, skin, fastly dividing cells. That's why people develop mouth ulcer.
Okay.
Skin of the hand, fastly dividing cell. That is why skin ulcer happens on the hand. And inside, in our cells, there is something known as mitochondria, which gives energy.
Energy source of
They
the
are
cell.
also fastly dividing. Now, chemotherapy reduces anything which is fastly dividing cell, and that is why all the side effects, hair loss, mouth ulcers, and less number of mitochondria causing fatigue, tiredness. So, patient's blood sample, everything subnormal hai. But patient will say, I'm tired. Life-threatening tiredness.
Okay.
Chemotherapy fatigue is known as सांस लेने की भी ताकत नहीं है. So much tiredness. So from patient point of view, relatives will say, yeah, this guy is, everything is normal. Why he is doing like this? But we doctors understand because of the mitochondria level going down, that patient is tiredness. Okay. Now your thing, targeted, is the next thing.
Okay. So because of this side effects, so many side effects like hair fall, you are saying ulcers.
Yes.
Next came the innovation treatment as a targeted therapy.
Correct.
Okay. So how this targeted therapy actually works?
So chemotherapy was a brute force, kill everything what is fastly dividing. Targeted therapy will target something in the cell.
Okay. Before coming this chemotherapy, on side effects, most common is hair fall.
Yes.
Okay. So for all chemotherapy, compulsory the hair fall will be there, or
almost all chemotherapy will cause hair loss. Simple,
alopecia,
because
like
fastly dividing cell. These are fastly dividing cell, so hair loss will happen.
Actually, this is also one of the society one stigma, this hair fall related to cancer. They think that people will get to know that I have a cancer.
Correct.
Yeah.
So now the innovation is there is something known as scalp cooling device. There are different companies like Paxman, Eva, in which we put a cap during the time of chemotherapy. It cools down the head to the extent that blood vessels in the head goes constricted. It's tight. Vasoconstriction happens. And when chemotherapy is given, chemo does not go to the hair roots. The hairs are saved. This is the innovation. But machine is little expensive. Not all hospitals has. Our hospital we have, but not all hospitals that.
So in that way, there we can chances of reducing this hair fall.
Yes, yes.
So looking at this, all the side effects, next came as like targeted therapy. So how this targeted therapy actually works?
The cell as a whole has multiple protein in the protein which is on the surface. If, for example, if this is the cell, this is the protein. Protein can be inside, and under the inside the cell there is something known as nucleus, where all DNA, RNA, everything is there. So a targeted therapy will act on a protein which is present only in the cancer cell, not on the normal cell. So it's a targeted only on the cancer cell. Example, CML, BCR-ABL we covered.
Yes.
So imatinib, which is CML tablet, which go inside the cell, attach to BCR-ABL gene, stop its function, and the cancer stops. Same way in lung cancer, on the cell there is a protein known as EGFR protein. If it is present, then cell is fastly dividing. So when you give a tablet which is targeted against this, it goes inside, it binds to it, it prevents its function, the cell slows down, it does not grow, or sometimes die also.
So in that way, we can reduce some side effects.
Not only side effects, this is much more effective. So if in lung cancer, if a target EGFR is present, we don't give chemotherapy, we give a targeted therapy only.
Okay. So
it's more effective than the chemo. But not all cancer cells we have this. Now this targetion can happen multiple ways. So one is blocking of the protein, one is killing of the protein. So the CAR I explained, CAR. So in CAR what is happening? Nothing is attaching here, but we are creating T cells, killer cells from the patient's blood cell, which will attack all the cell where this protein is present.
Okay.
So that is also a type of targeted, but where immune cells are involved. T cell is immune cell. This is known as targeted immunotherapy.
Okay.
What immunotherapy is present in India? So chemotherapy old, targeted next is immunotherapy available in India.
Yeah. Okay.
What it will does it? The T cell, natural T cell of the body present here, but not acting on cancer cell. Immunotherapy present in India will causes the engagement. So the T cell start working here. But it does, the immunotherapy at present available does not create T cell which directly attacks. So that is CAR.
Okay.
So this is evolution of medicine.
Okay. So chemotherapy, targeted therapy, immunotherapy. Okay.
Yes.
Sir, any other new innovations are getting ready that you are waiting for? Anything?
So during corona time, this CRISPR technology, silencing RNA, this technology suddenly got a lot of boost. So there are studies that somebody who has a, let us say a gene, let us say for breast cancer there is a gene like BRCA, BRCA.
Okay.
BRCA gene is expressed through certain RNA, right?
Okay.
We create a silencing RNA against BRCA, so BRCA is not expressed into our abnormal protein. So this is known as silencing RNA technology.
Okay. So you are silencing the...
We are silencing that gene which is responsible to cause cancer.
Okay.
No side effects. Because no killing involved anywhere. We are preventing the cancer growth. Okay. Same way, by CRISPR technology, we can actually remove the gene, or let us say some gene is defective. So we can fix the gene.
Okay.
This is the new thing coming.
Okay.
It's coming. In 1 or 2 years, we will see in global level. India में आते आते थोड़ा time लगेगा.
Sir, one more thing like about stage, we call in normal language about the cancer. You have stage 1 cancer, stage 2, stage 3, stage 4, as we have discussed in our...
Yes, everybody asks this stage.
So how you will decide the cancer patient is in stage 1, stage 4, and
what is the
impact and why this up to stage 4 only? You can... There is no more stage 5, stage 6, aisa.
So by definition, we call stage 5 is when patient is no more.
No more.
So
only 4 stages is.
Only 4 stages, but this concept is only for solid cancer. Solid cancer means stomach, anything which is seen on CT scan.
CT or PET
CT or PET CT or MRI. Some gant gadda, gant, tumor,
gadda.
something which you can see. Stage 1 to 4 is applicable on that. And simple thing, I'll take example of breast cancer. Here is the tumor, only this much size.
Localized to that
Localized
area.
to that area only, stage 1. Most important treatment is surgery.
Okay.
It is slightly bigger in size, but still only here, stage 2. If the nearest lymph nodes are involved, it becomes stage 3. If multiple places present, it becomes stage 4.
Stage 4.
So this is the stage. A stage 1 cancer which is poor responder to treatment is worse than a stage 4 cancer which is good responder to treatment. So stage 4 lymphoma is a good. I can still cure it. But stage 1 for even a gallbladder cancer or periampullary cancer is not a good news, because very high chances of relapse and not many chemotherapies options are there. So I explain to my patient, don't worry about stage. Worry about type of cancer. Do we have multiple treatment options? Then be happy about it. Oh, there are multiple treatment options.
Sir, as an oncologist, how your day starts, and is there any good, fascinating, you are fully satisfied stories of a patient where you have cured completely, and he is no more coming for at least for reviews also? He is completely happy, living a normal life. Anything, any such stories?
So I will tell you how my day start and how my week continues.
Okay.
Okay, each day is different. So first thing in the morning is I read the latest thing. What is new today in medicine? Okay.
So you are going to constantly update yourself.
Oh, in oncology you have to update. If in 3 months you have not studied, you are outdated. So morning people log newspaper पढ़ते हैं, अखबार पढ़ते हैं. I go through the scientific platforms just to have a gist. Oh, this is the new drug available. So I am updated. It may not be available in India, no problem. Somebody may come reach to me, sir, give me an answer option anywhere in the globe. I should be updated to say that okay, this treatment is available in Korea. Go there and take it.
Okay.
These are the people who will help you in logistics, but you can find a treatment. This treatment is available only in Germany. Go there and take it. Or we will import that thing in India. That is a possibility. So first I update myself with knowledge. The first 1 hour of me being awake, I update myself what is happening in business, because I am no more only a doctor. I am trying to get the technology from outside. So business means what is happening in the market, who is investing in which type of startups. So that is I update myself. Then I reach to them. I have a team, so they write to those people who might be interested in supporting us in getting the technology. So this is my first hour of one day. Now, end of the day, when it happens, I don't know.
Okay.
I might sleep at 9. I might sleep, mostly doesn't happen. Mostly I sleep at 1 a.m. Okay. When all my consultations are done, I have served whatever is expected from as a doctor from me, and then all international Zoom meetings happen with different companies, scientists, or etc. Intermittently, some Zoom call happens at international universities. So this is my day. Okay. Now in the whole week, Monday and Saturdays is mostly dedicated to the patients. The midweek is where I focus on the expansion of the science, expansion of the startup which we have created, getting new technology, association, visiting other industries. All those things happen in the midweek. So this is my whole thing. Sunday usually I spend people like you who invites me for knowledge sharing. Or I keep on updating myself. Upskilling, not only in medicine but upskilling other things also. Now coming your third question, do I have any stories
like where you have cured 100% cured cancer patients?
So I will not share stories of lymphoma cases, because lymphoma get cured even in stage 4. You treat anywhere. I will tell you there 3 stories. I will tell you. 10-year boy, stage 4, Ewing sarcoma, lungs deposits are there. Disease was here. I treated him in 2018 in Citizen Hospital, American Oncology. At that point of time, doctors, the other doctors, the surgeons, other medical oncologists said, stage 4, 6 months, maybe like that. I said no. Let me
never give up.
Never give up. Let me give the most optimal dose for this patient. Most optimal dose of chemotherapy, and let's see. Now he is 18-year-old, passed out from 12th, going to the college. He's still alive. He made a drawing of me, which is in my, all along my degrees, I put that drawing.
Okay.
Second case, this is when I was in AIG hospital, gallbladder cancer. Again, I'm not blaming anybody, but he was given 3 months in AIG. 3 months in AIG. We did certain tests for this patient from Switzerland, Germany and all, and we found which type of chemotherapy we can give. So chemotherapy which is actually meant for lung cancer, we gave to this patient in gallbladder cancer based on these tests. And he lived for 4.5 years.
Where the
3 months
3 months
to 4.5 years.
deadline दिया था.
Yes.
मगर he is
4.5 years. So these the second story, and third story I already covered, this CAR T cell stomach cancer, which I'm shocked, not impressed, shocked. Because after 4 different types of chemotherapy with present technology available in India, the response rate is near 5% or low. In that patient, if complete resolution of the CT scans are happening, this is shocking. I didn't expect that.
Okay.
So and this story keep on happening. One or more pancreatic cancer patient I treated in American Oncology in 2018, stage 4. During Corona, he developed Corona also. He lived for 5.5 years. So one pancreatic cancer lady is ongoing. Again, we did some innovative tests from Germany and Switzerland. So based on that, we found out which plant extract will work in this case. Okay. So plant extract, like turmeric, neem, garlic.
Yes.
There are enough scientific data that yes, curcumin can help in reduction in cancer. Neem can have reduction in cancer. Garlic can reduce cancer.
Okay.
But how to use this knowledge for a particular patient? So we did this test which were able to tell, okay, on this particular cancer patient's cell lines, curcumin is showing the result. Neem is not showing, don't give neem. Ashwagandha is showing. So we make a cocktail of nutraceutical products available in the over the counter on Amazon. Okay. And her CA19, which is a marker of pancreatic cancer, whenever it goes up, I give one chemotherapy. Then for 3 to 4 months, I give plant extracts.
So you are currently it is in practice. You are giving.
We are giving. She's alive.
Achha.
For more than 4.5, 5 years, she's alive with a stage 4 pancreatic cancer. So whenever CA19 goes up, I give one chemotherapy. CA19 comes down. Then 3 to 4 months, we continue with plant extract. So I am not exhausting my chemotherapy. So the cells inside are sensitive to chemo. But I give chemo whenever cancer is going up. Otherwise, I keep it controlled with plant extract. So this is what we do.
So one of the funny question. Have you heard anything like because of this coronavirus or corona vaccine? We hear like people are getting this heart attacks, MI.
Yes.
Like that, any cancer, but because of this corona vaccine or because of this coronavirus?
Nothing. So I worked in AIG, which was a corona hub at that point of time. I don't have a strong paper to support, but we found that there was flare during corona time in lot of lymph nodes. So patients, when we were doing some PET CT scan, post corona time, there was long-term lymph node inflammation, which resolved over time. So that much flare we have seen, but I will not say that increase in number of cancers.
Nothing.
Right now, so I cannot say. Time will tell.
Okay, sir. So one more thing, like you are saying some ashwagandha, some neem extracts. it will be like treatment like some part of like Ayurvedic. Because can we call it as a Ayurvedic treatment or?
I am not an Ayurvedic doctor.
Okay.
I don't prescribe Ayurvedic medicines.
Okay.
I don't know the principles of Ayurveda also.
Okay.
But yes, science accept that some plants, some plant extracts have effect on cell biology, how cells are working. For example, I'll tell you, you might have also observed that if you eat lot of chili food for few days, there is some inflammation in the body, like acidity you will get. Some people's acne comes. So this is evident in daily life. So some plant which are showing in the lab result in the cancer reduction in the lab under the microscope. Theoretically, giving that plant extract by oral route can reduce the cancer also. The problem is plant extracts are not easily absorbable. So you are taking a lot of 100 gram of haldi per day, but not 100 gram of haldi is absorbed.
Okay.
So it is better to take a liposomal or novel formulation plant extract rather than just crushing of the plant and then taking. It will not help you.
Okay. So actually why I asked this question regarding Ayurvedic, we have seen some of the famous persons, one cricketer also.
Yes.
He was saying that his wife got cured because of some food habits that he changed. Is that anything? Is
such
there
type
such
of claims keep coming? Media pops up only a part of such claims. If you see the whole story, the wife was treated by doctors in Chandigarh with conventional treatment also. Yes, she also took a health diet. She also changed her lifestyle. That was additive.
Yes.
But if you say, okay, don't take surgery, don't do chemotherapy, don't do radiation, just change your diet and cancer will be cured, it is unethical, unscientific, and I will say it's immoral also. Because you are a patient who is in stage 1, 2, 3, where cure is possible, you prevent that patient from receiving a standard treatment which is proven to help.
Yes.
Ask them to change their diet, take some special pill, do something, and then patient land up in stage 4. You have actually killed the patient.
Yes.
By giving a wrong advice.
Because see, now we are seeing so many YouTubes in videos, Google.
Yes.
So much of misconceptions, wrong information.
There are people who claims that do the test कराने में क्या जाता है, immunotherapy के नाम पे ये ले लो, लेने में क्या जाता है, but not like that. Doing unnecessary test is harmful. People should understand. It causes anxiety. It causes unnecessary extra investigations which is not justified. अभी एक नया ट्रेंड आया है, full body लोग CT करा रहे हैं. Whole body CT. Some AI driven CT scan screening of cancer. Unjustified.
Okay. Yes.
Unjustified. I have seen lot of such patient reaching to me with some borderline reports. Borderline. CA19-9 normal is 35, theirs is 37.
Okay.
Their CT scan is clear. But these people unnecessary every 6 months they will be doing CT scan and this blood test extra and they have the anxiety. Do I have cancer? Do I have cancer? Do I have cancer? This 35 and 37 is simple calibration error.
Yeah. Subjective, like doing the person.
So
maybe there will be some mistake in doing that.
So media is media. It does never predict the whole picture. I will say कि you take n number of second opinions, no problem, but take it from a genuine source before believing anything.
So one more one myth, we call it a myth or misconception is there among people. Is this cancer is a communicable disease? Means will it pass by touching or sitting beside them, talking with them? I think myth is there. Like, is any cancer is there which is a communicable disease?
Thankfully, cancer is not communicable. Otherwise, every cancer doctor would have contracted cancer in his life.
Because why I asked this question is like recently one of my known person needed a caregiver for her cancer grandmother. when we contact one agency to provide as a caregiver, simply that agency has rejected, saying that we don't provide this caregiver services to a cancer patient. So what is their like thinking, imagination? Like I asked that why means don't know, so like cancer patients we are not going to provide.
I think in your case, this particular case which you are saying, one is the need of a cancer patients are very different than a general patient.
Okay.
For example, a stomach cancer patient may have a stomy here where stool is coming out. A cervical cancer patient may be having lot of bleeding from down, which is not there with a old age patient.
Okay.
So that is one thing, maybe that. Yes, some, I will say, not so educated or not so aware people think that yes, it's a communicable diseases, because most of the other diseases are communicable. Somebody is coughing, other person can get cough. Somebody is having skin infection, other person can get. But cancer per se is not communicable. And if they are using a protection like gloves or something, there is no concept of communicable for caregivers. For family members, I will say no. It is not communicable. It is a genetic disorder.
Genetic disorders.
Genes does not get transferred by touching, never, except sexually transmitted cancers, which is cervical cancer and oral cancers, HPV related cancers. Otherwise, no.
Sir, coming to some cancers in the women, some breast cancer, cervical cancers. Sir, just now while I coming, I have seen one hoarding saying that for every 7 minutes, one woman is dying because of the cervical cancer. Okay. How much reliability is there in this statement?
See, many statements are twisted. Twisted in the sense, I gave money to Ram, Ram gave money to Sham, so I have given money to Sham.
Okay.
Okay.
Direct speech to indirect.
So it happens, and I'm not blaming anybody. But yes, cervical cancer is rampant in India, especially where unprotected sexual exposure is pretty common. Cervical cancer is one of the most common cancer in India, and it is often presented late. So I am not endorsing the statement that every 7 minutes one woman is dying. But yes, cervical cancer is a significant burden, presenting late, preventable with a vaccine, curable with a treatment with radiation and surgery, and often neglected because it happens in women. I am also pinpointing a very painful truth of society.
Current society.
That woman does not get adequate treatment. When a man gets cancer, it is likely he will receive full treatment. When a woman gets cancer, it's likely she will not receive full treatment for so many reasons. So I am pinpointing to this truth about society. So the diseases which is common in lower socioeconomic strata, unprotected sex, associated HIV. So HIV associated cancers like gallbladder cancer, cervical cancer, lymphomas are more common in lower socioeconomic strata. For obvious reason, they get more infections in the body, more damages. The infection also causes an imbalance in the gut microbiome. Gut microbiome is now proven to causes cancer in long run.
Okay.
So that is why fecal transplantation has come up as one of the preventive modality for cancer. So in socioeconomic strata where gut microbiome is unhealthy, they can develop cancer in the long run. So they have a higher chance of gallbladder, cervix.
Oh, these all were low socioeconomic.
Low socioeconomic strata.
So where the infections are high, in the people where the infections are high, usually these cancers.
Because of infection, they take antibiotic. Antibiotic will cause disturbance of gut microflora. Immediate level, no, it will not cause cancer. But over time, yes, it will cause cancer.
So this is for the poor. What about the...
See, rich people, they have other types of diseases like diabetes, hypertension, obesity, sedentary lifestyle. And the younger generation of affluent class has a problem of drug addiction, alcohol, smoking, etc., etc. So that is bringing, what they are bringing is cancers which are associated with hyperinsulinemia, means in your body insulin level is going up because of sedentary lifestyle, uncontrolled diabetes, etc., etc. Which cancers? Breast cancer. So breast cancer is more common in rich people, higher socioeconomic strata. Colon cancer, stomach cancer, these are related to the insulin level into the body. Ovarian cancer. So they are a rich population mostly reproduce less. So breast cancer is more common in richer people. The younger generation of affluent class who are involved into drug, if they develop HIV, then yes, the HIV associated cancer becomes more common. If they are involved into certain drugs, after taking drugs, they are involved into high risk activities like unprotected sex. So the unprotected sex associated cancers like HPV infection, cervical cancer, oropharyngeal, this area's cancer increases. They drink more. Drinking more, liver cancer. They smoke more, and now there is a hookah, shisha. So people think, oh, I'm not drinking, I'm not smoking cigarettes. Smoking is smoking, whether it is hookah, whether it is shisha, whether it is vaping. Digital, electronic cigarettes are also bad. So the same smoke goes into the lung, it causes lung cancer, gets filtered into the blood, it can cause blood cancer. The blood goes to the liver, gets filtered, liver cancer. From liver it goes to intestine cancer. From intestine it goes to bladder cancer. From bladder, penis to penis cancer. So the rich class is affected in this way.
So coming to all this treatment for the cancer, cost effective, some treatments are very costly like that.
True.
So do you think are this any pharmaceutical companies are influencing on the treatment? Like if there are some less cost chemotherapy drugs are there also, or these companies are making the doctors or the healthcare providers to prescribe the high cost, high MRP medicines. Like that, any influence is there? Do you think such?
I got your question. See, to be very frank, there is a dance going on between disease doctor, therapies, pharmaceutical house. And the scientific literature. Doctor per se, especially cancer doctor per se, the treatment is very much guideline based. Okay, this is the cancer, stage 1, this is the treatment. Stage 2, this is the treatment, like that. So direct influence of doctor, which you are having the question, usually does not happen. But yes, when a large pharma is funding certain researches, there is a dance which happens between various factors. But in today's world, when evidence-based medicine is there, this influence is way lesser compared to the previous time. Again, the media brings the picture which is most sensational. So, lot of stories you will hear which are kind of sensational, may or may not be true.
Sir, a lot of information you have given, so much of myths you have broken. Sir, how this, now we are seeing the latest AI, artificial intelligence. How this, anything like such AI in the cancer treatments you are looking forward?
AI is going to replace us in terms of the treatment planning. I'm telling you.
It will replace or it will support us?
At present, it is already supporting. So there are a lot of tests at the diagnosis level. The CTs and MRIs and PET CTs are read by AI, giving an equivalent reporting of that. As far as treatment plan is concerned,
and mainly in the cancer, oncology.
In cancer, I'm saying. In cancer, there are AI-based tests available, which are like, we have to give blood sample of the patient. On the blood sample of the patient, the full cellular pathway of the patients are determined. This actually happens in the lab. Now that data from which type of genes a patient has is parsed through literature, scientific literature already published through AI.
Okay.
And it, based on that, it gives a possibility plan that this chemo may have a higher result effect on the treatment. This chemo may have higher side effect in this patient. So such type of test is already available. The next phase of AI is using other medicines. Other means, let us say a BP medicine. I will take an example of a heart medicine, verapamil. It is used for cardiac arrhythmia.
Okay.
By giving verapamil, can I improve the effect of some chemotherapy? That type of test is already there. In India, I prescribe it.
Okay.
Leave aside the costing, they are expensive right now. But yes, AI is coming.
Okay.
And sooner or later, they will be able to make a plan better than me. What they cannot do is hand holding, which I can do. The emotions which I can understand.
Yes.
At present, AI cannot understand that.
Okay.
But
Sir,
AI is coming.
Yeah. So, sir, coming to the diagnostics test, CT, MRI. Lot of people know about what is CT scan, what is MRI. We do one this like PET CT, whole body PET CT, especially in the oncology, cancer patients. For our viewers, what is this exactly the PET CT means and how does it works?
Okay.
Just briefly,
Yes.
you can.
Imagine that this thing is cancer. If a CT scan is done, you will see in centimeter what is the size. Okay, let's say 20 centimeter, 6 centimeter, and thickness of 4 centimeter. This centimeter size is analyzed by CT scan. So PET CT is combination of PET and CT. So in this PET CT, I will get one information in centimeter size. I will get another information in the PET uptake. If you read the report, there is something known as SUV. Now imagine that this is a bulb emitting light. And imagine this is a bulb of 10 watt.
Okay.
One situation. There is another bulb of the same size, but of 100 watt. Which will emit more light?
100 watt.
100 watt.
Okay.
If you do only CT scan of both the bulbs, same size, you will say same cancer is there.
Okay.
But PET tells me, even though both cancers are same size, this is 100 watt light throwing, so the cells are active 10 times.
10 times.
This is 10 watt energy.
Which can be diagnosed by PET CT.
PET CT.
Okay.
The PET part of PET CT.
Okay.
So what does a PET do? PET is a dye. It is a dye given by injection. It goes into the full body. Wherever cancer cells are there, it get accumulated. And it start a light, which is picked up by a special camera known as gamma camera, or there are other types of cameras.
So especially this will be useful in staging of the cancer. Stage 4 decide.
It tells the stage 4 compared to CT scan, around we get 15% more information in terms of wattage. How much light is coming. So the patient asks, is my cancer aggressive? On CT I cannot tell. On PET CT I can tell. Yes, it is aggressive. So, low light, SUV 5.5, slow growing. SUV 35, fast growing. Also immunotherapy. Immunotherapy sometimes does not reduces the size, but reduces the light coming out of it. So that is also a response. So with new therapies, we are finding new PET type of diagnosis also. And you will be surprised to know, in Switzerland, we have more than 50 different types of PET CTs.
50
different types of PET CTs. In India, most common people have is FDG PET CT. But there is something known as DOPA PET CT for brain tumors. There is a DOTA PET CT for neuroendocrine tumor of pancreas. There are serotonin PET CTs. There is PSMA PET CTs. So it's PET CT of different type, but concept is same. CT will tell the size, PET will tell the light.
Okay. So thank you very much. So much of information you have given. Lastly, sir, is there any in future more of these oncologists are need for India?
Oh yes, we at present have somewhere around 1500 qualified medical oncologists, around 1500
in India.
In India, what's the population? Billions. So yes, we need it. But the problem is, most of the hospital setups are in tier 1 cities. Mumbai, Delhi, Mumbai, Hyderabad.
Okay.
The population is not in tier 1 city.
Tier 1.
Population is in periphery. That is why I want to create this multi-centric cancer care system all across India, so that every citizen of India have access to some cancer diagnosis or the treatment part. So most of the oncologists, who have spent, I became an oncologist at age of 36. I completed my everything. After age of 36, most of the people become oncologists at age of 33 to 36, depending on how many drops they.
Okay.
It is very difficult for a 36-year-old guy who has a family, maybe dependent parents also, to work in a periphery.
Okay.
Chalo, aapne bol bhi diya. And he agreed also. So Tata has initiated a compulsory 1 year posting in Assam. Compulsory. What if the infrastructure? What about the infrastructure? What an oncologist can do there if a CT is not there, PET CT is not there, OT is not there, chemotherapy is not there in the periphery. That is the role, that is the beauty of the system which we are trying to create. We are not trying to create a big hospitals in periphery. It takes time, money, licenses to open the big hospital. We want to open small chemotherapy daycare. We can open like this. In 3 months, I can open 50 daycares.
Okay.
And the whole country can be covered.
Yeah. Okay. So coming to the this next generation who completed their MBBS or general medicine, what advice you give for them? Whether you advise them to pursue this medical oncology, or what is your suggestion for the fellow upcoming doctors?
With present technology in India, I'll say we are still at the age of chemotherapy. Majority of our population will end access to cancer treatment with chemotherapy. If you are easily affected by loss of your patients, your patient life loss happens, oncology will break you. So my message to all younger generation is, you have to be very strong emotionally to become an oncologist. I used to get nightmares that I have cancer when I joined my oncology course 2013. Because we see our age group people coming with stage 4 cancer, dying in front of us.
Yes.
This is 10-12 years back. So if you are easily broken,
we cannot practice.
You cannot practice oncology. And one more, if you are somebody who believes in innovation, there are a lot of other options than doing actually clinical work. The lab can change the world. The discovery inside the lab can research.
If they are interested, they can move to the research side also.
They can research side, or I will suggest what I've seen in Austria: do half-day clinical work, half-day dedicated in research. Your one drug discovered or one device discovered. For example, I made a device. I have the patent of device which can control fastly dividing cells of brain. It's a device which patient has to wear. So if a device, a drug created in lab can change the whole world.
Okay.
But as a cancer doctor treating patient, you can change the world of one patient sitting in front of you. So you should do your aptitude test, what is best for your personality,
yeah, we have to decide.
And then decide.
Okay, sir. Sir, finally, what is your advice for this prevention, how to prevent this cancer, and what beliefs they should keep? Final one advice.
Avoid Californian gold rush. What I mean by that is, when I say prevention, people ask, sir, I heard about power yoga. Can I do that? Will it reduce my cancer? Or it will reduce my chances of cancer? Don't chase wild gooses. Do what is already known. Example, be active lifestyle, avoid alcohol, avoid smoking, avoid polluted food, which includes barbecued food, avoid unprotected sex. All these healthy habits which you already know, do it. Then comes the protection, actual protection. Get your genetic evaluation done if you have a high risk family history. Somebody, more than 2 relatives in family having cancer, or cancer less than 40 years of age somebody developed, you get yourself evaluated. If you are positive, then discuss with your oncologist what is your screening program. So screening program for general people will be different. Screening program for somebody with family history will be different. Get your screening test, for example, colonoscopy, PSMA, ovarian test, breast mammogram, and in mammogram also ultrasound mammogram, not old type X-ray mammogram. So this is what you should do.
Okay.